The COVID-19 pandemic has both personally and professionally impacted many, if not all of us. Despite the disruptions it has caused, the executive branch continues to carry out its critical functions. This is only possible because of your unwavering dedication and your efforts to serve all Rhode Islanders in their time of need. The Department of Administration has been working hard to provide the state with the tools necessary to navigate this crisis, especially measures to help mitigate the spread of COVID-19. Last week, we began phasing in a verbal health screening process in state facilities, with assistance from the Rhode Island National Guard and the Division of Sheriffs and our agency partners. Certain priority facilities, such as the state's hospital operations, were already implementing screenings and may have different protocols that are necessary for the protection of our patients and our healthcare workers. But for most state employees, here's what you can expect from our verbal health screening process. When you enter your workplace, please get in line in front of the screening area. Remember to maintain appropriate social distancing of 6 feet between you and everyone else. When you're called up, you will be asked if you're experiencing any of the following: cough, fever of 100.4 degrees or greater, shortness of breath or difficulty breathing, chills, runny nose, stuffy nose, sore throat, or diarrhea. That list of symptoms was provided to us by the Rhode Island Department of Health and may evolve over time as public health experts learn more about the disease. You will also be asked if you've returned from international travel, travel on a cruise ship, or domestic travel within the last 14 days. Finally, you'll be asked if you have had known exposure to someone with or under investigation for COVID-19. If you answer yes to any of these questions, you will be asked to leave the building and contact your supervisor and the Human Resources Disability Management Unit at 574-8401. During this process, a few questions have come up frequently that I would like to address. What happens if I have allergies or some other underlying condition? Will I be turned away? If you have allergies and can take medicine to become 100% symptom-free, you may return to work. You may also obtain a doctor's note. Otherwise, you must stay home for at least 7 days or more if you're still experiencing symptoms. We've also received questions about domestic travel, such as, what if I commute from Massachusetts? Can I come into work? And I returned from domestic travel within the last 14 days. Do I really have to stay home? Commuters are currently allowed to come to work, but we encourage you to telework if you're eligible and able. If you've returned from any domestic travel within the last 14 days, you must stay home for the duration of your 14-day period from the date in which you returned. I understand that you may be feeling anxious about this, but it is really important that you provide truthful and complete information to the screeners when you come to work. If you are sick or not feeling well, we need you to remain home and get better. We're offering additional flexibility regarding telework and paid leave, so please take advantage of these accommodations. Finally, this is a rapidly evolving situation, and we know it will be difficult to keep up with all the developments. As soon as we have new information and guidance to share, we'll do so via email. All communications and policies related to COVID-19 can be found at hr.ri.gov. Thank you for your continued cooperation and for all that you do for the state of Rhode Island.